It's great to have insurance, but if you're like a lot of folks, you just don't want to deal with it. And that may be particularly true if you're dealing with loved ones who are ready to be on Medicare. It's getting time to enroll them. Licensed insurance agent Kelly Parton of Health Markets Insurance is happy to help with that process. Good morning, Kelly. Thanks for joining us today.
Good morning, Amanda. Thanks for having me again.
Absolutely. For folks who don't know, at Health Markets, you will sit down with folks who are looking for insurance, and for free, you'll find the best plan that suits them.
Yes, we will. Yeah, it's never a charge to sit down with us. What we do is look at your situation. We'll look up medications if you want us to. We'll make sure that doctors are in network, or what plan they take. So you have a plan that hopefully your doctor is in network with, and you have all that information up front so you can make a great decision.
And we have a big window here coming up. It's an important time of year, especially for folks over 65. So when is the annual enrollment period start, and what do folks need to do at that time?
Okay, so anybody that has Medicare Advantage, whether they be 65 or older or even on disability, this is your annual enrollment period. It starts October 15th and it runs through December 7th. This is your opportunity to change your plan for next year. So that will be starting January 1st.
All right. So, you know what? There's a lot to consider with Medicare Advantage. Is there anything that's different with it here in the Toledo area this year?
There have been some positive changes, which is nice to hear for once. Some companies are increasing their networks to having ProMedica and Mercy, so people that have Medicare Advantage have a lot more options, and some of the plans are getting richer in what benefits they're offering. So it's a great time to take a look at what you have and see if it's the best thing for you in 2022.
Are there other options that may actually fit them better?
Yes, there possibly are. I mean, I can't get into detail by carrier, but we're seeing a lot of options for people that were at, this point for this year, next year. Things are increasing for them, so more benefits for them.
So when you talk about Medicare Advantage, I hear Medicare Part A, B, D, whatever. What is Medicare Advantage then? What's the difference?
Without going into a half-hour explanation. A and B is your original Medicare. Medicare Advantage takes over for original Medicare, so you have one company, one sector that you're dealing with instead of A and B and D, and it rolls it all. Yeah, I can talk about half hour on that.
It's an easier way to keep track of it with Medicare Advantage. So again, if people are interested, they're like, I didn't really maybe care for my plan last year. I want to make some changes to it, but I don't know the best route to go. They can just give you guys a call and you'll sit down with them. Talk us through the process. Do they need to just call you, book that appointment?
Just call me, yeah. Book the appointment. I have an assistant that helps out with scheduling. So, either myself or my assistant Allison will help you schedule a time. Our office is in Maumee, really easy to find. And then we just sit down and look over where you're at. Bring in your doctor's information. If you want, we will look up medications, and we talk a little bit, and I figure out where you're at in life and what's important to you. So one medication can really make a difference in somebody's plan and what they pay for per year.
Yeah, absolutely, and you guys can look at all of that and make those really important decisions. Kelly's going to be a busy back end of the year for you here. Are you ready?
I'm ready. It usually is. So we shut it down for the last 3 months of the year. We take Thanksgiving off. That's about it.
All right. Well, good luck to you. Thanks for joining us this morning. We appreciate it.
Thanks.
Yep. Take care.